Hello and welcome to another episode of 312, the HRP Podcast. This is part two of the Mold Podcast. In part one, we spoke with Kirby Mitchell, an attorney and the legal director of the Upstate Medical Legal Partnership. The MLP is a nonprofit that provides free legal assistance to low-income residents of South Carolina, helping folks deal with their mold issues. We do a lot of work with him through our South Carolina office down there in Greenville. And for part two, we'll be joined by Dr. Kerry Sease, a pediatrician who works with the Medical Legal Partnership. In a few moments, we'll take you to myself, Tad Gutchess, HRP's COO and president, and Dr. Sease tell you all about mold. For your ease of listening, we will attach part one of the Mold Podcast to the end of this interview. Make sure to stick around after both interviews for our Play Hard section, where you will not only be able to hear us, but watch us on HRP's YouTube channel, which is linked in the show notes. Mold. It's in your walls. It's in the air. It may very well be in your lungs. Mold is a huge problem with many different players helping to address the issue. If you listen to part one of our Mold Podcast, you know that HRP is one of those players. In our conversation today, we're going to hear a little bit more about what HRP does with mold, as well as the medical side, Medical Legal Partnership. Tad, Kerry, welcome to the podcast.
Thank you.
Thanks, Tom. Glad to be here.
Now, Kerry, would you be able to give us a quick introduction and maybe a little biography of yourself here before we get too far in?
Yeah, sure. So my name is Kerry Sease, and I'm the executive director for the Institute for the Advancement of Community Health at Furman University. I'm also a pediatrician, and I formerly served as the physician champion for the Upstate Medical Legal Partnership.
And how did you become a pediatrician? Was this a role you'd always wanted or something that you kind of discovered later on?
Yeah, so I've been practicing pediatrics for the past 24 years, and I pretty much always knew I wanted to be a doctor growing up, and really thought that pediatrics is what I thought I wanted to do. And then when I got into medical school and we do our rotations and explore, my hunch was right. I did love kids and went and decided that pediatrics was right for me. And then as I got into my practice and my training and my early years, I really got drawn more and more to community health and caring for those who really had historically been marginalized. That was not something I knew going into this, but that as I got exposed to it, realized that's kind of my career path.
Kerry, can you tell us about the role of the executive director for the Institute for the Advancement of Community Health at Furman University? What does that consist of?
Yeah, sure. So I'm going to refer to it as IACH for short. So in my role there at IACH, I really feel like I have a distinct honor to lead a team who's really passionate about improving the health of our community through what we call transformative initiatives. And the Upstate Medical Legal Partnership is one of those initiatives. Our mission is really to connect Furman to the community, advance research and education, and implement collaborative initiatives that will improve community health. So really, we aim to build capacity in Furman students, but also in our community. We facilitate community-engaged research, really thinking about how do we co-create solutions together, and then advancing the dialogue around what community health is. So similar to what we're doing here right now.
Well, Kerry, it's great to have you here. I've been looking forward to this for a while. Can you explain a little bit more about the MLP and how it works with the different pieces of that partnership?
Yeah, so essentially a medical legal partnership is a collaboration between healthcare providers, legal professionals, working together to address what we call health-harming civil legal needs. And so medical legal partnerships, they really integrate lawyers right into the healthcare setting. And so instead of us referring a patient that maybe we identify who has these health-harming legal needs, they're embedded in the health system. They're walking around the halls. They have badges, to be an integrated part of that. And that's important because it really helps patients address problems like access to benefits that maybe they've gotten denied from, housing issues, educational rights, custody disputes, et cetera. We use an acronym in the health system called IHELP to help identify what those needs are. And so that's income, housing, education, legal, could be legal status or other legal issues, and then personal issues like domestic violence. And so having them embedded right there in the healthcare system allows us to make a warm handoff directly to the lawyer instead of requesting that the patient actually go and seek that out on their own. And so when we're talking about people who are struggling, having some of these issues, having somebody embedded right there who is integrated with us, that we're kind of speaking the same language, makes us a lot more successful.
And you told us a little bit about your role as executive director. Can you get more into the details of your role in the MLP?
Yeah, so Furman, and you notice when I mentioned MLP, it's usually healthcare and legal that are together. And so oftentimes the partnership is also with a school. Traditionally, it's a law school or a medical school where you have those people connected to those two organizations. And in the Upstate Medical Legal Partnership, our education partner was Furman University, we were the first, and we think maybe still the only one who has partnered with an undergraduate organization to get students exposed to that. So not only do we put students in those places, but through the Institute for the Advancement of Community Health, we also are the evaluation partner, and we house the operations director for the MLP. And so in my role as the executive director, I get to oversee both aspects of that. And as a physician who previously was with the health system and was the physician champion, I also can provide that physician perspective as well. So that helps us as we think about the operation side and the evaluation to be able to bring that lens to it.
Fantastic. So what we are here to talk about today, in addition to the medical legal partnership, obviously, is mold. So I think, Kerry, you're a perfect guest to have on here to talk about the health effects of mold. Can you go into some of what that entails?
Yeah, so the effects of mold on a patient can really widely vary. It primarily affects the respiratory system when we're thinking about that. And I'm a pediatrician, and so I'll be thinking about kids who are having allergic reactions. If they have asthma, is that getting worsened by that? Chronic sinusitis, or just, kind of chronic nasal congestion that's happening. You can also get fungal infections. I don't see that as much as a primary care setting. Those might be when we're referring those on to additional specialists. And then certain molds can have toxic effects like black mold. So it can, again, be mild from allergic responses all the way up to some of those more chronic, and then certainly the toxic effects we can see.
And so what are the typical symptoms that would have you questioning if a mold exposure may be a contributing factor?
Somebody who has asthma, who has previously been what we would say well controlled on their medications, they're having more recurrent flares of their disease process, and despite us treating it with escalating medications, they're not getting better. Another example might be, the child does really, really well, or the individual does really, really well when they come into the hospital. Let's say they're coming to the emergency department, or we need to admit them to the hospital for a flare, and they get better when they're out of that exposure. But then when we send them back home and they're being, chronically exposed to that, they get worse again. So that's typically what we would see. Or, when you're removed from the setting, they get better. When they go back to the setting, they're getting worse again.
And are there any follow-up medical assessments once improvements to the living situation have been made? And if so, are changes typically identified, or are those more long-term monitoring type conditions?
We do, particularly in asthma, we do something called pulmonary function tests. So we can look at that and see, is the actual lung function improving? And so that is an objective measure that we can look at. And then we have some other more subjective measures. There's an asthma control test, which is a kind of a survey that we would give to patients and their parents if the child can't do it themselves, to better understand their symptoms. And we can look at that too to see, is that improving over time? But the most objective way is to look at that pulmonary function test.
Kerry, could you tell us a little bit more about the role the evaluation plays?
In our role as the evaluator for the medical legal partnership, we collect data on both the health and the legal side to look at the outcomes for patients or clients who have been referred to the medical legal partnership. So we look at health outcomes, we look at their asthma. Is it under better control? Are they not visiting the emergency department as often? Do they have decreased hospitalizations? That's an example for asthma specifically. And on the legal side, we tackle really to see, are their legal needs Was their legal need resolved? What type of intervention did they receive from legal aid? So we're kind of tracking all of that. And we're also tracking the patient's or client's level of perceived stress before and after the intervention. And I think that's really important because we're not only exploring the return on investment of these services. So is the hospital investing this and legal services investing in this, giving them a return on that? But we're also looking at the return on value. And that captures really total value, including those intangible benefits like societal benefits, obviously health, but beyond just what we're talking about objectively, and then organizational improvement, both for the health system side and the legal side. And so we're starting to see that come up more and more in the literature around this return on value. And so that's an important part that we play as the evaluator.
Turning now to kind of HRP's role when it comes to mold work. Tad, you have some familiarity with the work that HRP's been doing down in the Southeast. Can you tell us a little bit about what we're finding out there, maybe stuff about abnormal growth or higher count spore types?
So HRP support, we're typically focused on identifying if there's increased microbial activity that's present in an indoor air environment. Since mold spores can be found almost in any environment, indoors, outdoors, what we are looking for is abnormal spore counting. Indoors versus those of outdoors where mold is naturally occurring. Mold is everywhere. So you're looking for abnormal situations where that is good information that can be passed along to the situation at hand. Natural air filtration, we all have it in our homes and in buildings that we work in, can be a common source of indoor spores, which is something that we often take into consideration. And we are trying to identify, are there spores inside that are now outside? Are they higher counts? Are they similar spores? Is it a certain area that indicates that, we may have an indoor sort that's present, that's either increasing, amplifying, or having, a data point that is outstanding and a trigger for us to look into some more information. It's not a definite or exact science, though, since spore counts do often fluctuate in the natural environment, certainly seasons, weather considerations, geography, outside natural environmental changes. We also take into account other indicators. So we often not just test for mold, but we're looking at temperature, relative humidity, and even in some instances, carbon dioxide. Mold often is a problem when it has a food source. So if you look for said food sources, you would often find a pattern. And all that can come into play into the overall occupant comfort and general indoor air quality. Usually, and we do mold assessments in a variety of locations, but for a residential situation, a lot of what we see is related to overall building maintenance. Conditions such as leaks around doors, windows, gutters, caulking, roofing issues, inadequate grading around foundations, sitting water, leaking ports, that can all lead to increased moisture and microbial activity if it's not corrected. A lot of times people will see what they think is mold when sometimes it's just mildew, a different type of species. But it's also important to look at the ventilation system, and it's both at the heating as well as the air conditioning. That's why HVAC, heating, ventilation, and air conditioning systems, that they're sized correctly and also maintained according to manufacturer specs. You can have a problem where if you have something that's oversized or if you've had modifications to construction, the system works harder. And when it works harder, it has more condensate, and the condensate maybe become disconnected. And that might be disconnected in the wall that's on the second floor that's where most folks would sleep for the bedroom, or it's in a very heavy wooded lot where they're, typically in the South, it's very thick with vegetation and things don't adequately get to dry out. So there's a series of situations, notes, pictures, and observations we take during mold studies.
So, Kerry, which of the health effects from mold do we most commonly see in the cases handled by the MLP?
I would say for our upstate MLP, the most common ones we're going to see are exacerbations of chronic conditions like asthma or cystic fibrosis. We do have a cystic fibrosis center here in Greenville. And children and elderly really are disproportionately affected when we consider these effects. So asthma in the children and maybe COPD or chronic obstructive pulmonary disease in the older population. These are two groups that can experience vulnerabilities that put them at higher risk. And then if you add on those who are maybe renting and potentially in substandard conditions, you're just adding on those layers of vulnerabilities. And often they're not ones who can advocate for themselves for repairs for the mold remediation. And this is when the MLP really comes in handy, right? They may have requested to their landlord to get it done, but nothing is happening. And so they don't really know what to do. So the MLP can advocate on their behalf. They can do it through legal mechanisms, and they can also educate those clients then on their rights and what they know they can continue to ask for. And then the legal profession also educates us as the medical professionals as well. So we know who to refer, when to refer. And at times, maybe our own advocacy as medical professionals, I learned through my experience with the MLP can actually be not as beneficial as we thought. And so knowing when to refer to legal services earlier has been a huge education for me.
So, Kerry, obviously you can't disclose any patient information. Confidentiality is very important. Would you be able to give us a hypothetical patient that represents the likely conditions and struggles that the patients assisted by the MLP commonly face?
Sure. And I'll kind of walk you through how a patient might try to advocate on their own and when the MLP would be handy. So imagine we have a 10-year-old child with asthma, lives in an apartment, and they notice a small amount of mold growing in the bathroom due to poor ventilation, which we just heard about. So over time, the child begins experiencing more frequent asthma symptoms, right? They might be wheezing more, they might be coughing at night, and they're having to use their rescue inhaler more. So the parent knows that maybe they brought this up at the pediatrician's office, and we said, wow, this is worse than normal. So the parent notifies the landlord, but the issue really is kind of dismissed as minor. Nothing happens. And so the mold can continue to spread to other parts of the apartment. Now the child's having more frequent asthma attacks, more frequent trips to see the doctor, maybe into the emergency room. And so as their primary care provider, we notice this pattern. As I mentioned earlier, we now would start to suspect, is there an environmental trigger? Other things that might not be as noticeable is now the child's missing several days of school due to difficulty breathing, the parents having to miss work. They continue to try to have this addressed. They're cleaning it themselves, but still nothing has happened. And so they continue to report to the landlord, but it's now continuing to be ignored. Prior to the medical legal partnership, this is where I might have intervened. I might have written a letter myself, right, to the landlord saying, hey, this is a problem. This is medically affecting them. But what I've learned through my partnership is that I may be actually making things worse. They might be at risk for eviction if I do that. And so this could escalate. Right now, the child's going to the emergency room. Perhaps they're having to be admitted to the hospital. We're probably starting different medications now, what we call a controller medicine, which could have some long-term side effects for the child, parents missing more and more work. And so by getting the medical legal partnership involved now, and they can go in and do the advocacy, they can write the letter on their letterhead, and they can intervene with the landlord in a different way, we can prevent that child from having multiple admissions to the hospital. The family could potentially go on to have financial strain. If they have all these admissions to the hospital, that's going to increase their medical bills. Again, parent not going to work, et cetera, et cetera. And so by having the medical legal partnership going in, they can advocate for safe housing conditions. They can enforce tenant rights, right? They can write a compelling landlord letter, or they can actually take them to court, right? And so we could see that child going from having just mild asthma symptoms all the way up to frequent admissions to the hospital. That can all be from that mold that's there. And if we don't intervene, what we call kind of getting upstream on that, we could have the child could have damage to their lungs, right? Repeated bouts of asthma exacerbations, hurt their lungs, multiple courses of steroids. But also then they're missing school, the parents missing work, the financial strain, the emotional tax that comes onto a parent of having a sick child. So that's kind of the value that I was talking about before that sometimes is hard to measure when you're talking about all those stresses that happen.
From HRP's standpoint, the medical legal partnership really provides something that we've never really had access to. Typically, when we do an investigation that involves mold and we find out specific test data or analysis based on one or two situations where we sample, we could provide that to the owner. We could even provide that to the legal partner to let them know what conditions are. But what I like about this is that we can now really look at a situation and be the source in the field to provide the medical folks, such as Kerry, information about. She gave an example of an apartment that had a leak. And I was thinking we would go out to that situation and look what time of year is it. Is it in the springtime where it's compounded by the amount of pollen that's in the air? Do we have clogged drainage lines? What time of year? What was the parameter? In the spring, it's very lush. The relative humidity could be up 85, 89%. So we can maybe match some of that weather data to that, and also even perform something that's called a physical condition assessment. It's a PCA. It's done according to ASTM government standards. It's American Society of Testing Materials, which looks at the physical components of a building and are they constructed to code. That would be useful information that if we provided that to the legal services, they could use that in conjunction where maybe the medical folks and legals could use that as a focus of concentration. Also, this time of year, everybody is looking at their house, and there's mold growth on every house. A very common situation, different parts of the country. If you're in the Midwest, you're washing sand off your house. If you're in the South, everybody will have mold or mildew on their house. It might be on just the shaded side of the house, but it's on all buildings. Looking up the situations and parameters, we're able to provide, I think, extra data, which before the legal partnership could take it so far, but now they have a resource, not only with a medical partnership, but with a student group at Furman where they're doing research and getting involved with some other scientific facts that can really lead to change. And I think some of the change I would love to see is procedures and protocols for the standards that are out there as far as building care and maintenance, standard procedures for when a lease turns over. I don't know if leases now need to be filed with the county and what the legality of that, but cleaning recommendations that are mandated, looking for changes in regulations and maybe some legal requirements based on the landlord-tenant relationships. And one thing that really needs to happen is this is all for the good. And in the past, whenever you have addressed this, as Kerry said, a lot of times people would be evicted. That's not where we want this to go. It's got to be put in the format of where it's all for the positive. Some legal requirements and regulation as far as building codes and standards and maintenance needs to be maintained. There's maintenance requirements out there for office buildings in certain class space, medical facilities, food grade industry also have to have certain standards. Why don't we continue that with housing? I think that's where we could really go with this.
Yeah, and I think when you think about other resources that are at Furman, we have the Shy Institute for Sustainability. They do work on weatherization of homes right now, but I could see lots of opportunities where when we're identifying this earlier, I mentioned earlier getting upstream, but really even helping the landlords and everybody get upstream and start to think about when we first notice a problem. Now I think with better information from what HRP can supply, our partnership with within the MLP, we identify those earlier. We could find a hot spot, maybe this whole building, but how could we go in and do some of this work collaboratively, weatherize it appropriately? It would save the landlord money down the road as well. And so getting upstream benefits everybody in this situation. And there's so many resources here in our community that we could partner together to really advocate for change.
Well, Kerry, Tad, thank you guys so much for joining us for this episode of 312.
Thanks for inviting me. I loved it.
It's a pleasure. Really looking forward to some changes.
Well, folks, for those of you listening out there, we take you now to our earlier interview with Kirby. Kirby, thank you so much for joining us today on this episode of the 312 Podcast.
Thanks for having me, Tom.
We're also joined by Tad Gutchess, CEO and President of HRP.
Always a pleasure, Tom. Looking forward to this one today.
Absolutely. Kirby, why don't you give us a brief introduction of who you are for those not familiar?
Thank you. Yeah, so I'm Kirby Mitchell. I'm the legal director of the Upstate Medical Legal Partnership. So that's an innovative partnership between Prisma Health, the primary healthcare provider here in upstate South Carolina, Furman University, and South Carolina Legal Services, commonly known as Legal Aid. So basically, we are an embedded legal aid office inside a safety net hospital. Lots of patients that roll into the hospital, they've got conditions that are caused by or exacerbated by environmental issues, the housing they're in, or various issues like that. And so HRP Associates has been great kind of helping us address some of those cases.
So this is classified as a medical legal partnership. Can you tell us more what that means?
Yeah, so that is a creation from the early 90s in Boston. Dr. Barry Zuckerman was a frustrated pediatrician. He was seeing kids with asthma, cystic fibrosis, conditions like that, where they would be fine under his care within the four walls of the hospital. But then when he'd send them home to their moldy apartment, same issues. And so the doctor kind of realized he was not the solution to that particular medical problem. He was a pulmonologist, a pediatrician, an expert at this, but he had, I think, the humility and the wisdom to see that this type of medical problem might need another team member, another part of the solution. So he connected with legal aid lawyers. That developed really well in Boston. It slowly spread across the country. There's now about 300 of these MLPs, medical legal partnerships, in some form or fashion. Here in South Carolina, we were the 41st state to get one. And so, we here in the upstate started ours in late 2016. We took a little time. Working out that type of partnership is not easy. We kind of joke that a doctor, a lawyer, and a PhD go into a bar. Mm-hmm. That's an MLP. Mm-hmm. But yeah, we took about 3 years to do our first 500 cases, and then that really has grown exponentially. We've done about 3,000, and the demand is really increasing.
And Tad, can you tell us a little bit about the technical expertise that HRP provides, what its role has been with this medical legal partnership?
Yeah, sure. What Mr. Mitchell Kirby would do was he would often talk about the background and the science. Hey, I have this issue. What typically can you do that will identify a problem? And so a lot of times what we would do is do analytical testing. We would collect examples. We would do a background survey of conditions, because conditions are very important whenever you're doing health surveys and industrial surveys. So the environment they're in, the temperature, the relative humidity, the situations that they're in. And at times you always want to do some sampling, and you want to do a proper sampling protocol where you have a good average to take from both outside and inside people's living quarters. And you would sample for a variety of mold species, a lot of long names with Greek endings on them, but some of those are natural occurring molds that we find in cheeses and foods and things like this. And then some of them are good molds and bad molds, and you really want to discern where they are and how they affect a situation of somebody's environments, not only once as a data set, but you want to come back and see if it changed. So this week, this day, this night, the different change in the seasons when you have someone's environment. So we could provide that data to someone like Kirby's group for them to look at and analyze.
And Kirby, can you tell us a little bit more about why a partnership like this is so valuable?
Low-income folks that are eligible for legal aid, they often are also eligible for assistance with their medical care. They qualify for Medicaid or Medicare, or we help a lot of vulnerable veterans or folks that really are getting helped by totally separate professionals, doctors and lawyers, with what had always been no communication, no coordination. And so the medical legal partnership is just a savvy way to take these public resources and coordinate and work together. Like think about if I help one family in a moldy apartment, usually these apartment units, it's multiple families that are dealing with the same issue. If the roof is leaking, it's not just one unit. So those are all people that are being driven to the emergency room, that are missing school, missing work. So it's kind of I think in academia now, this is widely accepted, the social determinants of health or social drivers of health is what you hear folks label that. But it's just I would say a common sense recognition that, maybe you don't pump a child full of powerful steroids and medications without at least first looking at, hey, what if we addressed the mold or the irritant or the bed bugs or whatever the environmental issue is first, that can get upstream, that can help so much in the long run. And also, like I mentioned, it has that wider ripple effect. Usually we're not just talking about one unit.
What about, again, from like a really general perspective, associated health risks?
Yeah, that has been something that professionals here at HRP have really educated me somewhat about. Here in upstate South Carolina, mold is really common in so many buildings. We have a lot of humidity here, like you'd expect. We have some housing stock that's quite dated. So, yeah, I think the effect that mold has, it really varies a lot between the type of patient or client. But what we really focus on, which I think you can appreciate, it's young kids, up to age 3 or 5 or so that have a condition like asthma or cystic fibrosis or something that, generally the pediatricians tell me those are the vulnerable years. That's where you can have irreparable harm or scarring or a reduction in the ceiling of development of lungs and kind of vital organs. So we really focus there. As you can imagine, some folks, they have mold in their apartment, but I've had clients that they also smoke or they have multiple pets. And, that can be a challenge then to try to persuade a jury or a landlord that the cause of the health problem is strictly the mold. But yeah, that's just something we deal with cases we accept and kind of choosing which ones to focus on. HRP has been helpful to me in the cases where we really are confident that it is an environmental issue within the apartment, particularly mold generally, and that's something that the landlord can be required to address, and then we see a health improvement.
I was going to say, too, one of the things when you're talking about mold is most people do think respiratory, pulmonary as well as that, but when you have a situation like that, it could be nausea, people are tired, the lack of sleep, which breeds it. But the big thing is the synergistic effect when you're combining it with other parts of their environment. And that's the problem. And any one of us could have the mold situation. Kirby had mentioned about smoking, mold with smoking, and just any kind of external factors, where they live, the pollution, the industry that's getting involved with this. They're trying to beat back that synergistic effect.
So what happens when we discover a problem? What's the life cycle of that?
Let me run through a kind of maybe a typical medical legal partnership case that involves mold. Now, we handle all kinds of cases, all kinds of social issues that affect people. Some are family court cases, probate court. Not everything's tenant landlord, but I do get a pretty steady diet of pediatricians or pulmonologists saying to us, hey, we think you should take a look at this, lawyer, because we think maybe there's issues. It sounds like something in the apartment that could be the real cause. So first thing I do is go to the apartment. I've learned enough to know that laying eyes on it early is helpful. And just with what some of the good folks at HRP have educated me, I look for a water source. I look for moisture. I look for what may be the cause. Sometimes it's as simple as a air conditioner unit that was never properly leveled. And so water builds up. That's pretty common, actually, to my surprise. So sometimes I've been educated enough to kind of start to have theories about some of the causes. Sometimes I have no clue. And we escalate to the level of HRP professional getting in there, taking a look, maybe doing a test. It varies so widely, Tom, what you see. Some units are relatively new, and yet, the construction today is so tight that there's almost no ventilation. That's you might think it's only the older units that have the problem. it really varies. Sometimes it's just from a toilet overflow or, a chronic situation that a plumber made a mistake. But basically, we start there. It's a doctor who has identified a health problem, and we're investigating if we can link it to an environmental cause. And then confronting the landlord with that. Sometimes that can be a letter, that can be a pleasant conversation, that can be a not so pleasant conversation, that can be mediation, that can be litigation. So that's where the attorney kind of determines the resolution of that case. But that's kind of the typical life cycle.
And going back to the beginning of that life cycle, would you say that maybe a majority of the issues that are seen here that lead to mold are easily preventable things, and that prevention could be a huge issue with this? Or are these kind of inevitabilities of the ecosystem in which the Southeast is located?
Man, it varies so widely. I mean, I think in particular, as we see, what's referred to as climate change or, extreme weather, I don't know that you can prevent some of this. Water intrusion seems to be the driver of a lot of it. And then just the lower income clients that legal aid assists, they're often kind of dealing with the brunt of that, the less wonderful properties and just not having the resources to address it when a problem does arise.
I would think one of the things is mold or spores are everywhere. They're in this room we're at, but they're at a controllable level. That's why we have air filtration, things like this. But there are some low-hanging fruit that are out there. And if you're looking at building construction, if you're looking at residential housing, a lot of times you can look at folks having a water leak, replacing the carpet. But unless you do something with the subflooring, putting a brand new carpet over a problem will not stop that mold growth, because Kirby had mentioned looking for a water source. Mold needs to have sunlight and a water source, and it will keep on going. The idea is to clean or dry that out. So the things such as slow leaks, or that was leaking through the roof. So it could be a patched roof by someone who is inferior, or construction that's been done by something that's inferior, or is taking the low route or the most cost-effective route. What you will see a lot of times, if there is a leak, you don't necessarily cut the leak out as much as you replace the whole wall or cut half a wall out of sheetrock. So you're looking at oftentimes poor construction. So visible molds, visible stains, water through light fixtures, leaking toilets, the air conditioners Kirby's talked about. If there's any water supply or when anywhere we're standing water, a lot of times we look at mosquitoes. That same water would be a breeding case for mold. But it's the construction that's done. So you want maybe a history of what has been done, what has been retrofitted, what the materials were used, and even finding out what was removed and where did it go. Those are a lot of the things that you do to try to find, which ends up breeding the mold. And unless done properly, you're going to have a problem.
So Kirby, tell me more about the landlord experience, because I got to imagine there's a variety of stuff there, from like the worst of the worst to the surprisingly helpful.
Yeah, Tom, you're right. There's such a diversity of landlords. We have a lot of units here in the upstate that are managed by out-of-state companies and huge owners or managers of rental properties. And then, that ranges all the way to a guy with one trailer in his backyard that he, spliced the electricity himself and kind of created a rental unit. So you've got a massive range. You've got sometimes family members renting to other family members with no written lease. It just varies so widely. So, yeah, that has really dictated the experience. A huge difference for me is when the property is some form of public housing. You may have heard the term Section 8 housing, or there's veterans housing or different subsidized housing projects and units here all across the upstate. It's kind of a weird patchwork, and we even experienced lawyers, we struggle with knowing sometimes exactly what federal program or state program that housing authority or subsidy comes from. But that really helps determine how the litigation or the addressing of the problem proceeds. Because sometimes you find a very willing and responsive landlord, whether that be public or private. I've been kind of impressed with how some landlords, had no idea until we raised the issue with them and they went above and beyond. Unfortunately, I've had a lot of landlords who just tried the cheapest remediation. One of the biggest complaints isn't the mold itself, it's the sort of pretend attempt to address it, or just sort of just paint over it, or just buy a can of Kills, or there's this, I think, still lack of understanding of how damaging that can be. Again, particularly in the context of let's say you have a 3-year-old child who you think is unable to breathe in the middle of the night. That's the origin of a lot of these cases for me, like frantic trips to the emergency room where people are staying in the hospital for a couple of days. So, I think not every case is that extreme, of course, but I'm kind of haunted by knowing sometimes that if we don't address this when the child is 1, 2, 3 years old, it's really going to actually have a lifelong effect. And so those cases really kind of move to the front of our priority list.
We're recording this not too long on the heels of Hurricane Helene coming through the Carolinas and eastern Tennessee. Can you tell us what you think the impacts of the hurricane will be?
Yeah, it's a great question. My guess is we will see in the next few months an uptick, some increase in of the medical legal partnership cases referred to me by doctors and nurse practitioners, some uptick in these issues with mold, because we just in the upstate had hundreds and hundreds of trees hit roofs and houses, and then think about this. I mean, power was out for a lot of people for a week, even longer. So no air conditioning, no fans, no, all the ventilator systems and things took quite a break. And we've had the typical seasonal humidity here. So that would be my guess. Of course, I'd love to hear what the environmental engineers and folks at HRP would guess just based on what they see. That would be my prediction.
Yeah, one thing you're going to start to see is building materials. And you're going to see building materials that are either cut out because water damage has occurred from said trees or damage to buildings and appurtenances and stuff like that. You're going to see a lot of that. And we've done a lot of hurricane response in the past in Florida, Texas, areas of that nature. And to going into these houses now that are secure, safe, you have power. Kirby mentioned a big one there, when the air conditioning will control the relative humidity. When the relative humidity is too high, you will have mold growth just naturally without a lot of moisture. It's the moisture in the air. But there is a way you can go in with a simple moisture meter and take readings on sheetrock and decide whether it still has too much moisture or not. And that tells you where your remediation is. And that's why I always mention, you never cut to the line of remediation where the moisture is. You always go above and beyond to ensure something is dry. Then you can patch and do your repairs. There's also relative humidity meters and other things that are very cheap that you could take and walk through a building and say, geez, the east side is very bad. We've adequately remediated the west side, and you can document things of that nature. So you're going to see a lot of roofs get replaced, a lot of sheetrock, windows. You'll see a lot of that debris on the side of the road because people are addressing that form of the situation. And unfortunately, you will see it in some of the areas of environmental justice because, people were out power anywhere from 3 to 10, 12 days. That's enough time to have a problem. Mold can be slow growing or it can be fast growing. You don't know when it's going to come out, but a lot of times if you do not have the utilities working properly in your area, it's going to be an issue at some point at everyone's building.
When would we recommend that someone out there who may be listening to this, may be worried about how they've been impacted by hurricane damage or flood damage, what should they be on the lookout for in terms of when they think they might want to get in touch with you?
Well, for me, Tom, it's all driven by the medical condition. So certainly there's a lot of attorneys available to folks if they think they've got an issue with their landlord. The medical legal partnership approach is laser focused on health problems identified by doctors and lawyers. So if you're doctors and nurse practitioners and others at the hospital. So if your treating physician thinks you or your kids are having breathing issues related to your housing environment, that can become what we call an MLP case, for at least for investigation and addressing that. Like Tad mentioned, it goes beyond just mold and difficulty breathing. That can have nausea and other issues, long-term impact, and pulmonologists and other medical professionals have really helped me understand what type of filtration, for example, or air filters, or weather stripping, or they're pretty good. That the asthma professionals, that's not a condition where there's a cure exactly. That's a condition where you learn to deal with it and minimize the impacts of your environment and sort of your microclimate. And so I've learned a lot from the doctors and from the folks at HRP that really are where you start before any sort of legal attempt to address it.
And coming around, I think, to close up here on just a point of interest for me, have you ever testified in court?
I have testified in court, but usually I'm the one asking the questions of an expert or a witness. I'm glad that I got the opportunity. A lot of lawyers, have never, for example, served on a jury or been a witness in a case. And so it's kind of a humbling and useful experience to kind of see it from that perspective.
Is it anything like what we see on TV?
Occasionally, there's so much law on TV now, but I think, I have a lot of Furman students who go to court and observe with me and kind of watch what we do at the MLP, and they often come away thinking, that wasn't as fancy as I expected. I think, there's a huge range in the formality and grandeur of, for example, a federal courthouse, and then where most landlord-tenant cases are heard, what we call magistrate courts or summary courts in South Carolina. Those can be in trailers and kind of modest facilities themselves, probably with mold themselves, now that I think about it. But yeah, it's, legal aid and the medical legal partnership tend to be more of a people's court type legal system, but that's where the real problems are, and that's what people really need. And, HRP has been great to help with individual cases that really matter.
Yeah, absolutely. Fantastic. And I guess just to take us out here, I would like to know a little bit more about the two of you, because you guys go way back, as I understand it.
It's been a while. It predates South Carolina. I would say we got to know each other late 80s, early 90s, I would think.
Yeah, a good high school friend of mine worked at HRP and was a roommate of Tad way back in the day. So we became friends back when you would get together to go to a concert or drink a beer, perhaps. And Tad and I have known each other for ages and just been friends and golf buddies. And so this partnership has been really kind of special for us. I speak for both of us, but it's been kind of cool to take what we do for a living and kind of see, hey, we can actually benefit one another and really benefit a lot of other people. So it's been great.
Yeah. And it's one of those things because we have played a lot of golf together, but it's often been said a lot of business is done on the golf, but you just kind of talk when you're on the golf cart. And it was kind of neat seeing this partnership that Kirby had. And for me, it was a breath of fresh air, because it was like, finally, we got more than one institution involved to fight a problem, because a lot of times you do everything you can and then it usually ends there, or it's good for 5 or 6 years and then the problem starts back up again. And, through a couple rounds, we talked about this, and hey, that's pretty neat. And you saw the success of it. And, Kirby talked today, geez, you said thousands of cases since the time you started to do that, which is phenomenal, because it's great to see that. It's great to see that does benefit the environment.
And I would say stay tuned because, we started here in the upstate, but now there's a medical legal partnership that has started in Charleston. There's one in Beaufort. They just announced one in Spartanburg. And so I'm looking to share what we've learned with HRP, and maybe HRP can serve the state in this role. We're going to look for a little seed money or a grant to kind of test that. But certainly this is not a problem just unique to the upstate. There's cases exactly like this all through South Carolina, and I think the medical legal partnership is really expanding in a really healthy way. So I'm hopeful that we'll be able to report to you even more success with this approach going forward.
Awesome. Well, we'll check in again soon.
I was going to say I'm glad to see that expansion because in 30 years since I've been in South Carolina, the population's gone from 3.1 million to 5.3 million. So those numbers tell that the need is there. So I'm glad that the support service followed that need. Oftentimes it goes the other way, but I'm glad it's kind of going hand in hand with that.
Fantastic. Oh, well, Kirby, thank you so much for joining us today.
Thanks for having me.
Yeah, thanks as well.
Thanks, Tom.
Just want to give you folks out there a bit of a content warning for this Play Hard section. We're going to be talking about the hit show Last of Us, which does have a lot of violence in it. So we will be having a discussion about that, and just want to let you know ahead of time in case you want to choose to refrain from watching that part. But it's a great discussion, a lot of fun with our CFO, Joe Cardinale, and we will go join that now. Hey everybody, welcome to the Play Hard section of 312. As those of you listening will know, the Work Hard section of this episode was all about mold. It was, in fact, the Mold Podcast, Part 2. So it seemed only natural to follow that up with a Play Hard segment that was talking about Last of Us Part 2. So we're joined today by HRP's Chief Financial Officer, Joe Cardinale, who is joining us remotely. And Joe, you're about to embark on a big vacation, so why don't you kick us off by telling us a little bit about your upcoming vacation?
Thanks, Tom. Yeah, very excited. I am turning 50 on Sunday. Yeah, nice. Big 5-0. And my wife decided to surprise me that she's going to take me to Liverpool, England to see my favorite soccer team, Liverpool, play on my birthday. So very excited. Leave actually in a couple hours to start the trek down to JFK and catch my flight. And I'll be in sunny England on on Wednesday.
Well, we appreciate you making the time to join us today, Joe. We know you're a
problem.
big video game guy, so I'm sure this will be an exciting one for you. Now, before we get too much off the topic, I did go to England once, and I thought that it sucked. But you are looking forward to this vacation. Can you tell us a little bit more about why you are excited about this trip?
Well, I mean, this will be my second time to England. First time just London, and I was there in the summer, and I'm surprised you had such a didn't like it. Well, I think you caught bad weather almost the whole time, right?
Well, London was great. We went there, but then we spent a lot of time in the countryside, which...
Yeah, this will be my first time outside of London.
To me, the English countryside is a less interesting version of Massachusetts. It just feels the exact same as just going up there, but it's like the people are a little ruder and there's a little less to do. And the bars close at 9 o'clock, and they serve 2 beers. So that's
Well, I mean, I'm very excited. Spending some time with my wife, going to flying into London, immediately jumping on a train right up to Liverpool. She's a big Beatles fan, so we've got that planned. I'm excited for the soccer game. I've got a couple events to go. I mean, I've got a stadium tour to do on the Friday. So I'm excited for that. I left a lot of room in my suitcase for stuff to buy and bring back. So, super excited. Can't wait.
Nice. Jumping back into today's topic, Last of Us. Just to give a quick synopsis for those who are not familiar or maybe have forgotten. So Last of Us follows the story of a world in which humanity has been nearly wiped out by a fungal infection, which has the unfortunate side effect of turning people into violent zombie-like creatures that seek out and kill other people. And it follows specifically the story of Joel and Ellie, who are trying to survive in this new world on a cross-country road trip to reunite with family and hopefully find a cure for this infection. Season 2 picks up in the violent aftermath of Season 1, where we kind of see the culmination of events from the first season. So,
probably should stress, Tom, that this is spoiler, not spoiler-free. This is going to have a fair amount of spoiler.
We'll do a little bit of spoiler-free stuff, I think, at the front. Okay. But yeah, we're going to very quickly get into spoiler territory here. I guess, first of all, without spoiling anything, Joe, what is your overall feeling and opinion about Last of Us?
I enjoyed the first season a lot more than this first episode of the second season. Mm-hmm. And I played the video game, so I'm well aware of everything that's going to happen. But what I really liked about the first season was the deviations from the video game.
Yeah.
There was a lot of good, really good content, and some of the better TV content overall in that first season. And there was barely any real, quote unquote action even in the first season with the infected and all of that compared to the video game. So it was a really cool deviation from the video game that made it really enjoyable. So far in the second season, not so much. They've been truer to the video game, except for some exceptions. Looking forward to the second season if they can replicate some of that stuff too.
Yeah. What stood out to you like most in the first season?
Really, honestly, it's those. Was it one episode or two episodes with what's his name?
Nick Offerman.
Yeah, Nick Offerman.
Yes.
Thank you. Yes, mm-hmm. Yes. Was it one episode or two episodes of those guys?
I think it was just one episode where we were just with the two of them the whole time.
Yeah, and there's nothing in the video game of that, and that episode was one of the better TV episodes, of all year, basically. Mm-hmm. Just thinking of how good quality and writing that was, and a storyline within a storyline, that didn't fit really into the whole aspect of what's going on in the show overall, and it was just very well done. And to me, that was really nice. But as far as the story, seeing the development of the relationship between Joel and Ellie, you get that in the video game too. That was pretty close as well, since I'll stick to staying out of spoilers, but mm-hmm. seeing the father-daughter type relationship grow throughout the season. So
yeah, I think am a little bit bored with Last of Us generally. I was very satisfied with the game and the first season of the show, but zombies generally are something that I just find to be quite boring. And so really
it's definitely gotten that way.
Yeah, it's kind of played out. And the only stuff that I really find interesting in that media anymore are stories where there is some like real interesting novelty to it. There's some kind of different take on it, or it just approaches it in a very different way, which is certainly true of the game. And again, to specify for people, we are talking about the second season of a show which is an adaptation of a video game that came out in 2013. And I think it's important when you're trying to appreciate what's going on with this story as an adaptation and how it approaches things, is that I think Last of Us came out kind of the middle of this golden age of zombie content in the modern era, because 2013, that would have been season 3 of Walking Dead, when that was still a pretty fresh show that everybody loved and was watching. And And kind of before the zombie phenomenon, I think, kind of cratered to where it is now.
I mean, it got played out for sure.
Yeah.
I mean, what I enjoyed about the video game in 2013 was just a different take on the zombie genre, basically, and focusing more on the two of them rather than, and that storyline rather than, strictly just zombies everywhere.
Mm-hmm. Yeah.
Also, it was a very well done video game at the time.
Yeah.
I think it was a PlayStation 2, I believe. 3, I mean. I think it was a PlayStation 3.
At least.
I'm pretty sure it was a PlayStation 3 game, and now we're on PlayStation 5. So, I just enjoyed the video game story aspect of it, where that developer really focuses on a lot of story in their video games.
Yeah. And in much the same way that this whole genre is feeling kind of played out and lacking kind of innovation and originality, you can't help but remark on the number of times this game and its sequel are being remastered and re-released to the point where it seems like no one has any new ideas for video games.
It is true that Last of Us 1 was done, I think, redone 3 times. Yeah, for PlayStation 4, PlayStation 5, and now I think there's a new one that combines both of them together. Last of Us 1 and 2.
Yeah.
If you want to spend $100.
Mm-hmm. Yeah. Now, before we get more into the show, talking about the game, what did you think of the gameplay for the Last of Us franchise? Because that's one of the aspects that people, I think, focus on a lot, but I don't know. For me, it was never really a standout in that regard. The actual way that it played.
Disagree.
Yeah. Okay.
So I'm very used to. I've been a video gamer for a long time, and now I'm 50 and still doing it.
Mm-hmm.
But I highly enjoy the third-person action type games. I always had, and honestly, I think. Naughty Dog, who's the developer of these games, have done such a good job of mixing the action in the third-person view with this game and with Uncharted series that I really enjoy the get behind cover, the crafting a little bit. So to me, I guess if I were to pick a genre for video games that I enjoy the most, it's the third-person action type of game. So this one did a pretty good one with survival. You don't have a lot of material and stuff, but you always seem to find material everywhere. So scavenging, I guess, back then wasn't as good since they skipped a lot of stuff and left a lot of stuff behind, which I always find funny. But again, it's a video game.
Yeah.
So to me, I really enjoy that type of game.
Mm-hmm.
So.
What stood out to me about the gameplay that still sticks with me is the unbelievable brutality and violence of the way that it played.
The Last of Us, definitely.
Yeah,
for sure.
That was
the Uncharted series, or the other big series that they have, that is not in there.
No, yeah, and it's kind of funny that this is something that is such mainstream appeal. Both as a video game and as a show, because its approach to violence is extreme and realistic in a way that is tough to handle. And I think that is, as an artistic accomplishment, is really the point.
Yeah, I can see that.
Yeah, because it is really about, just the same way The Walking Dead is, the nature of conflict between people, which is like the whole zombie thing is really just a jumping off point to explore that and the extremes of that. And
yeah, and The Last of Us, I mean, you could almost argue that the killing of humans, in the game is way worse than the killing of the zombies.
Absolutely. And
just from the brutality standpoint and all that, for sure.
It is definitely meant to, as much as possible, have a very real emotional impact on you, the player. Really feel that and think about it in a way that I don't think any game had ever accomplished to that point or has been able to do so since.
Yeah, no, I 100%. And, when you really think about it too, all the people you're killing are also trying to do what you're doing and surviving in a world that has been overrun.
Yeah, and that's what makes Last of Us a great story, is exactly what you're talking about, is that all of the people there, everybody is doing horrible things, and all of them feel like they are justified in doing so.
Sure.
Whether that's survival or I guess more in season 2, serving a need for vengeance or some sense of justice in the world.
Sure. Yeah.
So, talking more specifically now about this most recent adaptation, I've only seen the first episode of season 2.
Same.
Okay. And I was kind of bored by it.
Same.
Yeah.
I actually got to say, as a player of the video game, I actually am highly disappointed in the first episode. Very disappointed.
I heard a lot
for a few reasons.
I heard a bunch of those reasons, and they seemed pretty valid for me. I haven't played the second game because I felt I was very satisfied with what I got out of the first game and didn't feel a need to come back to that story. Felt like it did what it was set out to do, and I was, just fine with it.
If you were going to watch the second season, I almost recommend you play the second game, because it will, so far after the first episode, the video game has a way better feel to it.
Yeah.
As far as the storytelling compared to right now. And I guess we should probably stress that we're going to get into some spoilers right now.
Yeah.
So if people haven't seen it or are waiting, maybe listen to this part after we watch that first part.
Yeah. Yeah.
Okay. So I guess where I really, really disliked this show first episode compared to the video game, and I'm going to spoil the video game for you, but I know you're not a big spoiler fan anyway, so it doesn't matter.
Doesn't bother me.
The video game had such a shock value to that scene that you don't know who Abby is. You have no idea who Abby is in the video game. You play both Abby and Ellie in the video game, but you have no clue who Abby is at first. So the scene basically, it was a pretty good, her running away from the zombies, all that stuff, even the zombies in the snow and all that were in the game as well. Not as big of a horde, that is a whole nother thing. But Joel does save Abby in the video game, and they go to that chalet and everything, and then all of a sudden she turns on him and boom, does what she does and kills him.
So in the video game, there's this kind of crisis moment.
Yep.
Joel, who's our main character, one of our two main characters that we've been following, saves this who is essentially a stranger at that point.
Complete stranger.
Someone
idea.
who he doesn't know, but just takes them in.
And we don't either as a video game player. No idea who she is.
And in the aftermath of that, they have they start talking to each other, and this person, Abby, realizes that this person who saved her, Joel, is the person that she's been looking for, because
Correct.
she is hell-bent on getting revenge for the murder of her father by Joel, which was
in the first game.
Yes, the ending of the first game.
He shoots the doctor, which is Abby's father.
Yes.
Now, I do want to stress, even in the video game, Joel never finds out who Abby is. Joel never knows. Abby kills Joel. Joel does not know that he killed her father. That does not come. Joel doesn't realize that. Obviously, in the show, she says it to him before she kills him. But in the video game, there is no revelation. So Joel dies not knowing why Abby killed him. which I really enjoyed. It made you also a little more sympathetic to Ellie's at the point because she breaks into the house and sees it all happening. Also, there's a slight change in the video game compared to the show. His brother is there as well. So Ellie and her brother see him die, see him get killed. Where in the show now, only Ellie is the one. Because the person he is with, Dina, it was drugged and, put in another room. That is something different. So I don't know where that's going either. But
yeah. And now Joel is a character that we've seen through the first season and first game being someone who does not hesitate to do whatever he needs to do to accomplish his goal.
He does whatever he has to do.
So and even though we are sympathetic to him or kind of on his side, these are morally gray areas at best, as to who is in the right and the wrong. Yeah,
I mean, Abby did the same thing.
And the specific scenario that Joel found himself in, which is probably I think it's got to be the most difficult moral conundrum of the whole game, is that Ellie is immune to this fungal zombie infection. So
she has the cure in her brain stem.
Supposedly.
Fluid. That's what they said.
That's what we're led to believe.
Correct.
So the whole cross-country trip in the first game and first season is to get Ellie to this
Seattle.
Yeah. Was it Seattle?
Yep. Portland? Maybe Portland?
Oh, okay. I thought it was like Denver or something. I thought it was like, oh no, they're the Tommy and whatever, Joel's brother and them. They're in the mountains, right? They're in the Rockies. Correct. But this thing is over. Okay.
Yeah.
They're trying to get Ellie to this hospital that has like one of the last organizations that still is operating, the Fireflies, because the Fireflies are telling them that they will be able to get a cure for the infection from Ellie. Joel realizes that in order to get this cure, they are, I think, most likely, if not certainly, going to have to kill Ellie to perform the surgery.
I think they do say that they have to kill her.
Yes. So then Joel is faced with the decision of, do I allow this to happen for the possibility of a cure for this disease, which, given the circumstances, seems like a stretch. Like maybe that could work, but then how would they, go about doing that?
Yeah, and they've kind of said that in the video game too. I mean, they do say that we're not 100%. Obviously.
Yeah. Or he can, because he is the kind of guy that can do this, he can go on a killing spree, murder everybody, and save Ellie. So do you save the person that you care about most in the world, or do you allow them to die for the possibility of saving, everyone? And Joel chooses to go on a killing spree, in part because that's just kind of how his character operates. That's just what he knows how to do. He certainly doesn't know how to let go of somebody who he cares like that, since this person has become a surrogate daughter for him, which, by the way, the opening of the first season and the game as well is one of the best sequences in all of video games, bar none, where you are following Joel and his biological daughter at the start of the infected apocalypse, only to have her shot and killed in Joel's arms as they're trying to get to safety.
Correct, yeah.
And that informs his character throughout the rest of his time. As we've followed him, it makes sense that Joel would be in a situation where somebody wants to kill him for revenge, because there are many, many times in which that has been the case.
Sure.
And
where are you going to argue? You can't argue with Abby's motivation either. Losing a dad who is basically just working, and getting involved in this situation. I can't blame Abby for doing what she's doing.
Yeah. I mean, I'm personally not a revenge guy. I understand it as a character motivation, of course, but I don't think it's the same. I don't think it is a morally justified activity, right?
Yeah. In a game, it plays well, but you're right.
Yeah, it's sensible as a motivator, but it's not like I have to do this in order for innocent people to survive, or I have to do this to find a cure.
Yeah.
It's like
100%.
I'm just trying to satisfy this need inside myself.
My dark need of you killing my father, right?
Yes.
Yeah, and that leads me, with Abby, leads me to the other part I did not like. I don't like the character change that she's had from the video game to this. Again, you didn't play the video game, so you know. But in the video game, she's been on a journey that you're not getting through the first episode. I mean, I don't know what they're going to do moving forward, but she has also been through a journey of just hate-filled rage that has changed her completely. I think, in the game, you get that through backstories, through flashbacks and things like that. But the character change in the game, she's actually very well built. She's a pretty big person.
Yeah, she's massive. She's jacked.
Massive.
She's swole.
Yep.
Yeah, she's big.
But she didn't start that way. No. That was part of the journey as well. She wasn't like that, in the flashbacks. And she becomes that because, again, I think there's steroids used. I think there's a lot of stuff that gets her into the character that she's in, that so far in the first season or first episode with her on the show, it just doesn't translate as well. Again, basing it on the first episode, so who knows? But
it seemed like a very strange choice to me. Not even having played the game, but it just seemed odd that we were going to have a scene with Abby that just kind of has them talking about all of this, just like, yes, this person, someone killed all the people I care about, and I'm going to get revenge. It just seemed like the lazy storytelling that the first season really, and the games too, were better than, if that makes sense.
Yeah, and that's what made the game, and that's why I dislike the show so far, the second season, is that the game took that away from you, so you were it had more of a shock factor. So, I mean, when Joel died in the show, obviously I already knew he was going to die.
Yeah.
But my wife didn't. She had no clue, and I didn't say anything.
Yeah.
But she kind of knew he was going to die because, they led up with this different storyline where that Abby and the group of former Fireflies are on their way to Jackson to do what they got to do. And then obviously they get there and they see Jackson is a well-built, massive city, and it's not going to be as easy as they think. You don't get any of that in the game, which made the death of Joel, 1,000,000 times more impactful than this one.
Yeah.
And Joel shows up in the video game a fair amount, but just more of a voice in Ellie's head. I also don't, as of right now, I don't like the adult version of Ellie either. The thing is in the video game you get the same feeling about Ellie. She is kind of a dick in the game as well as in the show. So that I guess is, I hate it, but it is pretty true to the video game. So we'll see how it all plays out. But in the game, and I don't know if this is going to happen because of the way the show is so focused on Ellie and Joel and Tommy and things like that, and Jackson. I don't know how the show is going to handle. The video game was a lot of Abby. Like, there was a lot of Abby. Abby was a big part of the video game. And I don't know how the show was going to handle that. It seems like it's not going to handle. It seems like Abby will not have a very huge role in this. There might be a coming to the end type of thing where they meet up again. But I have a feeling, and again, that's going to take away from the game and the show comparison. But
Yeah.
again, what I liked about the first season was the differences. So who knows? I don't want to say it. I just think that the reason I didn't like this first episode or second episode was the fundamental change to the video game that took the shock factor away.
And this is a very difficult, story to adapt from an interactive medium to just a passive one, like watching something, because with Joel's death specifically, if you're very invested in The Last of Us as a franchise, it's really unlikely that you don't know that he's going to die as part of the story.
Sure. I mean,
that's a piece of information that is exceptionally hard to avoid, and the people most invested in this have likely played the game and already know that. And so adapting the story for that audience, as a creator, you want to bring something new to the table, but then you have balancing that with people that really just want to see a shot-for-shot, one-to-one live action version of the video game that they played.
I didn't need to see a one-for-one, but what I think of is your same example that you use, but in a different setting. I'm looking at it for the people who don't know what's going to happen. Mm-hmm. For instance, I never read Game of Thrones. Yeah. So my wife knew about the Red Wedding. So when that came up and I watched that was hugely impactful. Yeah. Huge. So that's kind of what I was hoping for in reverse on my wife who hasn't watched it, to see, and I was like, oh, maybe they kill him on episode 1. Maybe they kill him on episode 2. Mm-hmm. But I was hoping for that. I think of that scene. I think of Game of Thrones and the multiple times in the early seasons of, big characters dying right away. Mm-hmm. And my wife knew Ned Stark was going to get his head cut off. I didn't. Yeah. I was like, holy moly, Mm-hmm. I'll bring a Harry Potter example. I had no idea Dumbledore dies, and then he dies. You're like, what? So to me, that was the whole why I really didn't like it. Is it took away from people the shock value to the people who don't know what's going to happen. Because I felt like that shock value had a lot of impact on both Ellie's change in personality, well, already was changing, but more of her storyline, and also Abby now fulfilling her prophecy of killing Joel, and what happens to Abby after that. Mm-hmm. So I felt the shock value had a lot to do with that, and now it's been taken away. And again, I don't know where they're going with the show because it's only been a couple episodes, so they could figure that out and change it up. But that's my biggest disappointment. Also, I'm not really sure what they're doing with the whole town invasion type of thing. That's a little bit different as well. Obviously, Tommy wasn't even there during anything, so I don't know if they're playing more into the whole, home front of Jackson, Wyoming. I'm not really sure what's going on. So again, I'll keep watching, but I mean, for me, the shock value, taking away the shock value, kind of disappointed me for other people, basically.
Mm-hmm. Yeah, I think too with the medium of video games, when you swap a character's perspective like that and you're now playing as Abby, you become sympathetic to her because you are the same entity, right? 100%. So her struggles, what she's trying to do, her actions she takes are the ones that you're taking. Mm-hmm. So you naturally have this inclination. I mean, you can't help but be in her perspective and see it from her perspective, whereas in a show, you can maintain that distance. You don't have to feel for her struggles, for that character's struggles, the way that you are unable to avoid. You don't have any kind of implication or sense of ownership of decisions that she's making, because in the show they're just happening. In the game, you're the one doing it.
You're interacting, yeah.
Yeah.
Yep. I mean, in the game, the second game, it was very more story-driven than action-driven as far as gameplay. You know, for the most part, you're escaping, you know, some kind of zombie type of thing. Where in the first game, there was a lot more interaction with video game. You know, there wasn't, as a video game, you know, fighting and things like that, where the second one, there was a lot less.
Yeah.
But I completely agree that you playing as the bad guy or the good guy, you become invested in that character, regardless of what their motivation is, almost.
Yeah, yeah. Well, Joe, I think that's going to wrap us up here. Any final thoughts on Last of Us? Are you hopeful for where the season's going to go?
After the first couple episodes, I'm a little more reserved. I worry they've made too many changes to come back to. Maybe. I mean, I don't know. Again, like I said, the first season, what I really enjoyed was the deviations.
Yeah.
I just think some of the deviations they've made so far have actually hurt the show more than helped the show. So.
Yeah. I'm not terribly excited, but I think it'll still be a pretty great season of television all around, and I'm sure I will check it out and watch it and enjoy it. So.
Yeah, I mean, and then there's just so much TV. I mean, I know this is The Last of Us, but we have Andor also starting today.
That's what I'm really excited about. Yeah.
Yeah. So for Star Wars people, this is probably one of the more anticipated shows, especially how good the first season was, and how good the movie was that this character also is in. And yeah, it's probably for me the most anticipated show.
Yeah.
Andor.
I think we've hit a point in the history of television where you don't actually need new shows. I think there are so many great shows, you know, banked up in the history of TV at this point that you could basically just start rewatching. And by the time you finish the list of the best shows, you're ready to start it over again. You've already had enough distance. And that, for me personally, would rather just rewatch the best shows than some of the newer ones that I think are okay. I was rewatching Succession and getting more excited about the reruns of Succession than the new episode of Last of Us.
Yeah, I wouldn't doubt if I picked up on Breaking Bad again or Better Call Saul, and those are some of the best shows on TV. Agreed. I mean, I guess my point on TV too is that with a lot of shows now, I don't know if it's just the lack of creativity, a lack of IP with a lot of these shows, but they're just using the same, just going over the same stuff over and over again, Star Wars shows, Marvel shows. And it's making it more and more difficult. But on the flip side, shows go in cycles. If you remember in the 80s and 90s, the Italian Mob had a pretty big run of shows, movies. Think of Goodfellas, think of Sopranos. I just think that we're in I don't know if it's a creative or it's a money-driven thing, but obviously, the economy of shows dictate a lot. And if they can make a lot of money on a Marvel show to get people to subscribe to Disney Plus, that's what they're going to do. So, it's sad because you lose a lot of good writing and things like that to these shows. You have great directors and writers that are basically doing kid stuff and try to make them adaptable to adults as well. So I totally see it. I'm hoping the cycle comes back eventually. God, it would be nice to get a good crime drama series. I know Peaky Blinders was pretty good. I didn't watch all of it, but that had some good aspects to it. But shows like that, I know there's a new one too that seems interesting. Warlords, it's called. It's with Tom Hardy and Pierce Brosnan in, I think, Ireland. Don't quote me on where, but I think somewhere there, and it's mob related. So, and I do enjoy I don't know if you do, but I do enjoy the Guy Ritchie type stuff, and that I think it's his show. I'm not positive, though.
All right. Well, Joe, thank you so much for joining us today.
Thank you, Tom. I'm going to be leaving in about an hour or so on my trek, so appreciate the time. Thank you.
Yeah.
I do want to say to a lot of the HRP people that are listening, I just sent out my CFO quarterly update, and so far Q1, I've been here 11 years. I've never seen the amount of positive results that we've had so far. And really, when I can go through the science of the numbers and all of that stuff, but when you boil it down to why the success of the first quarter of 2025 is where it is compared to basically any time frame that I've been here, 11, 12 years, I'm not sure, is because of how busy and efficient our employees have been. Everybody's working, a lot of hours, working on projects, charging their time, and a lot of credit to project managers as well, because a lot of that time being charged is being billed to the client, and hopefully paid for. Knock on wood. We haven't got to that phase of the quarter yet. That's coming up. So, but all the positivity in the results is really from hard work from the employees. So hopefully that continues. I would love to be able to sit here and talk about at the end of the year when we do our year-end podcast of how well the first quarter led into the first, second, and third and fourth quarters. Because with that good year, I think next year is also so far in good shape as well. When you're looking farther out, 2026 has a lot of positives as well. Already, it's past that is really the question marks that is just a little too far out to see. And with an incoming presidential administration, and this is on all administrations, not just the chaos we're getting at this one. All administrations have a little bit of the first quarter jitters for companies because they don't really know what's going to happen with the administration, regulation, deregulation. So they kind of sit back and wait a little bit. Yeah. We have not seen that as far as HRP. I think the timing just worked out very well with the way our jobs were set up, that this quarter just happened to be extremely busy. So there is a lot of that's happening. And we'll see how the administration continues to do what they're doing, if it causes any issues. But for the most part, I said this in my email, that the consulting business, the whole industry, not just environmental, usually feels recessions after it happens, because there's a lot of booked contracts and things have already been, earmarked. But on the flip side, we also are the last ones to come back, because obviously once a recession happens, people pull back and we don't see those contracts that are going out. So I am very highly optimistic that any type of short-term recession, 1 or 2 quarters worth of recession, will not have a very big impact at all on our company, because we are so well built or well set up for the next 2 years. It's a long recession that could cause problems, because that stuff that's happening next year could cause some slowdowns. But so far, so good. Great first quarter. And really, again, all the hard work that the employees are doing on the jobs, the hard work the project managers are doing, the hard work our support staff, including you, Tom. Yep. Your drone work on job sites and your ideas for pulling in more work. But, even the other departments, the accounting departments work, it is Admin Professional Day. So a big shout out. Yep. So a big shout out to all of them. So really our first quarter was, everyone's hard work.
Nice. Joe, well, thank you. I'm sure everybody appreciates that message. Folks out there who have joined us, thanks so much for being here. Remember, you can rate us 5 stars if you're listening to us out there, or if you're watching us on YouTube, you can give us a thumbs up or like, subscribe. We will see you in the next episode. Bye, everybody.
Bye, everybody.